let's say you have a patient who comes in and you've done everything you possibly can, and they simply refuse to go back to work, and they are complaining of symptoms that are disproportional. The causation book says that certain risk factors occur for carpal tunnel, occupationally. You've now eliminated those risk factors. They come back in a week. What should they tell you? Should their symptoms be the same, better, or worse?
Definitely worse from what I see.
Yeah, Dr. O'Neill says they're always worse, which is a good point. Hopefully they should be at least the same or somewhat better. Because again, going through the causation criteria, temporality, dose exposure, duration, time, if these are truly the risk factors for what's causing the individual's condition, what should you see? If you remove those, you should see an improvement. If you don't, I would put that in my note. Does that say you're saying malingering? No, you're just saying that from a scientific basis, it's difficult for me to understand if the symptoms the individual are providing, she relates to her work activities, and her work activities have been modified or reduced, and yet her symptoms have increased. That does not fit within our current scientific understanding of causation. Did you like that line? It's not in the syllabus, but you can save it. All right. So you have to confirm whether they match or don't match. So you have to be a little bit more of a detective in this process. And you know, again, earlier when you asked me about the question, the person says they ride a bike 5 miles a day. And so I immediately fire back with some questions about bike riding. Or they like to hunt or bowl. I don't disbelieve my patients. I simply want to make sure that they're providing me accurate information. So the more you understand that job task, that job duty, or the hobby they're listing, the better off you are of getting accurate information. And that's what we are. We should be reporting accurate information. That's why I put everything they tell me into my notes, whether it be good or bad. I'm not here to decide whether that's in their best interests or not. My job is to report the information. Now, as a treating physician, I'm an advocate for my patients, but I believe the best outcome for my patient is early return to work. You can't show me any study that taking somebody off work is to their advantage. If you can, you have my email, send it to me. So, my bias in life is what? People should stay at work. They live longer. If you take somebody off work, suicide rates higher, death rates higher, I mean, on and on and on. Causation is important for you to understand to allow that person back to work. So we're kind of back to that circle that we started with in the beginning. It's the holistic approach